Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning. This is Dr. Kim Allen Williams welcoming you to the Cardinal Minute. Today's Grand Rounds was given to us by Dr. Brian Dong. He's an assistant professor of medicine, formerly a University of Louisville internal medicine resident and Hem-Onc fellow. And he's currently in the Division of Medical Oncology and Hematology at UofL Health and Brown Cancer Center. He presented a tremendous Grand Rounds on entitled Update in Breast Cancer Genetics and High-Risk Breast Disease. Dr. Dong, can you give us the 60-second version for the Cardinal Minute?
Absolutely. So what I want to do is give you an idea of what a high-risk visit is like with me as a breast oncologist in the clinic. So each visit is divided into two parts. The first part is regarding genetic testing, identifying, a full family history, risk factors associated with breast cancer, ovarian cancer, and even pancreatic and prostate cancer in some cases, and identifying patients that do qualify. And one of the stigmas I wanted to kind of break down was the cost of genetic testing. Oftentimes there's a stigma that it is $2,000, $3,000, $4,000, $5,000. And I would tell you 80% of the genetic testing that we did at the Brown Cancer Center in 2021 was covered for free. So do not let cost be a barrier to getting genetic testing done if you do have that family history. The second part of the talk was revolving around future surveillance. So identifying who's high risk independent of genetics, revolving around things like atypical ductal hyperplasia or atypical lobular hyperplasia, biopsy results that aren't necessarily cancer, but do increase your risk for future cancer. I also cover something called the tiracusic, which if you are at all worried about your own personal risk, or you have a friend that's asking, or another family member, or someone that you know that is curious, I would simply Google tiracusic, and it's a 2 or 3 minute calculator. They can go through and plug in your information, and it'll give you a 10-year risk and a lifetime risk for breast cancer of the person putting the information in. If your risk is over 20%, then you may qualify for MRI breast screening in addition to mammograms, and you should consider talking to a breast specialist like myself or someone closer to you. What I would say is all these discussions require multidisciplinary team between an oncologist like myself, a breast surgeon, and also breast radiologist. So certainly seek out a team that you can trust and make sure you're doing the best for yourself.
Well, thank you, Dr. Dong. We really appreciate all that you presented, and we're hoping after your presentation that breast cancer genetic screening will be widely adopted and help improve, particularly the healthcare disparities that we have in our African-American population presenting earlier with more advanced disease and having fatalities, in fact, before the time of recommended screening. And thank you very much. This has been a Cardinal Minute.